Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. Today, we continue with our theme of Don't Get Your Gastrointestinal Tract in a Twist. Today's case is a 6-year-old male neutered Great Dane who initially presented 2 days ago for vomiting and was managed on an outpatient basis. Although the vomiting has subsided, he remains anorexic. On presentation today, he was tachycardic and shocky and painful during abdominal palpation, but has responded well to some intravenous fluid therapy and pain management. His CBC shows that he is volume contracted with a hematocrit of 62, and his abdominal evaluation with AFAST is normal. What we observe is that there's marked to massive dilation of a segment of the colon. It is filled with heterogeneous soft tissue and gas. We appreciate that there is a classic C-shape structure in the left mid-abdomen caudal to the gastric fundus, and this likely represents the cecum. If we examine the fundus of the stomach a little closer, we do observe that there is an irregularity along the lateral margin. This is not well defined on any other view. The descending colon that we observed in the caudal abdomen is narrow and contains a small volume of gas. The remaining structures are unremarkable within the abdomen. In the caudal thorax, we observe that the caudal vena cava has a slightly variable but generally narrow diameter, and that the pulmonary vasculature has a mildly narrow or thready appearance. Our conclusions for this patient are segmental and consistent colonic distension with suspected abnormal positioning of the cecum. Primary consideration is given to colonic malpositioning, specifically torsion, or vascular compromise, such as entrapment. We have to consider the potential for concurrent gastric mural change or gastritis, and there is suspected hypovolemia. The changes associated with the gastrointestinal tract are primarily linked with the cecum and colon. There is global distension of the segment of the colon that is in the region of the ascending and transverse segments. However, the path is particularly difficult to confidently trace. Radiographic features that are typically associated with colonic torsion include segmental distension, consistent malpositioning, and cecal malpositioning, and these factors are present in this exam. The feature that we do not observe in this exam is focal narrowing, which often delineates the site of torsion. This may be obscured in this patient by the distended segments. Of uncertain clinical significance is the noted change in the gastric wall. Further evaluation of this global picture may be able to be made with computed tomography due to the size of this patient. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.